Joining us now to discuss is Dr. Jeffrey Kassinove, psychologist and co-founder of Therapy West. Doctor, good to have you on. It's interesting to point out anxiety and depression that could possibly happen during the pandemic, but I think you got to dive further into it. It's what the anxiety and depression causes people to do in these moments, and that what could possibly affect them. And we've seen that, like alcoholism, other things. Just kind of weigh in on that.
Well, I think certainly the pandemic that's going on has caused significant mental health issues. Certainly drug abuse, we're seeing increases in that, increases in depression, increases in anxiety, and increases in just general stress, because this is a major shift in our lives to not be able to go out and see friends and go to work every day. And our schedules are so different that it's really easy to just stay in our pajamas and not get dressed and go to work, even if it's virtual every day. So it's having a really significant impact on the public and on all of us.
Yeah, I want to ask you that. I have you here. Have you seen the number of patients suffering from depression and anxiety? Has that went up?
It has. I think, what we seem to see is that the coronavirus is really a risk factor, right? So this is a big effect in the world, and the rates of depression are increasing because people are also isolating, and they have less of a supportive network around them to bolster them and reduce the depression. And instead, they're starting to slide a little bit more, and we're concerned about that.
Do you think there's a difference in the way that we as a whole collectively treat a physical health versus mental health? Are we only concerned about the physical health aspect? Is there concern for the mental health aspect? Is there enough of it?
Well, I think mental health professionals have always been concerned that there's a lack of awareness of the need of mental health providers. I mean, clearly with the coronavirus, we are gravely understaffed throughout the United States. It's always been that we've been the second profession to be looked at, and medical issues always certainly come first, but mental health has been definitely underserviced.
That is Dr. Jeffrey Kassinove, psychologist and co-founder of Therapy West. Good to see you, doctor. Thanks for joining us.